It's not uncommon to see a lot of patients at Centra Care with upper respiratory infections. Common cold symptoms like cough, runny nose, and sore throat are fairly typical of the patients we're seeing this time of year. But we're also seeing an increase in the number of patients coming in with symptoms of vertigo, a sudden onset of that spinning sensation that comes on as a result of these same viruses that cause cold symptoms. But in some people, they just wake up one morning with a spinning sensation. They feel like they just got off a merry-go-round. When they move their head or roll over in bed, the symptoms are markedly worse. There may be nausea or also vomiting associated with it because you're feeling seasick, and some people have an unsteady gait. Some people come into the center tilted, just kind of walking down the hallway at an angle. They can't maintain that gait upright. And what's causing that again is this respiratory viruses that get down into the inner ear. And this has nothing to do with hearing or ear pain, but as we look at this model of the ear canal, the tympanic membrane, middle ear, and the inner ear is composed of the cochlea, this snail-shaped organ. But the other half of the inner ear are these semicircular canals that are the vestibular apparatus, your balance organ, and that's where the inflammation gets into. So it's a little confusing when I tell people that they have this inner ear inflammation or infection caused by a virus, because it's not really an ear infection. It's vestibulitis. It'll last for 2 or 3 days and go away on its own. But as with any neurologic change or symptom like vertigo, you might want to get that checked out by a doctor, because there's a lot of other things that can cause this, and some of them can be fairly serious. So with the sudden onset of vertigo, if it's not easing up in a few hours or a day or two, or if it's accompanied by any other neurologic change like headache, numbness, weakness, get in and get that checked out right away by a doctor.